Out of the 234 samples, we have received confirmation of 9 people who have tested positive for coronavirus disease. This now brings the total number of confirmed COVID-19 cases in Kenya to 59. Tracing of the contacts of the 59 confirmed cases is ongoing. So far, the total number of close contacts that we have so far been monitoring stands at 1,668. Out of this number, 508 have been discharged from contact follow-up process after completing the 14 days follow-up period. Currently, our teams are monitoring 1,160 close contacts of confirmed cases. Following our statement yesterday, we would like to mention a few areas that touch on our level of preparedness. To begin with, isolation centers. Earlier this month, we launched Mbagathi Hospital as our main isolation center for patients who test positive for coronavirus disease. The hospital has a capacity of 120 beds, and it continues to play a key role in terms of testing and isolating those who are found infected with the virus. We have also put in place Kenyatta University Teaching, Research and Referral Hospital that has a bed capacity of 300 beds, which we are in the process of equipping and boosting capacity. As I informed you yesterday, we are also exploring the usage of our boarding schools countrywide in the event the situation worsens. We have engaged county governments to identify specific boarding schools which would be able to assist in boosting our capacity. The national government continues to work closely with county governments and are effecting the President's directive in equipping the level 4 and 5 hospitals in response to COVID-19 cases. With regard to health workers, fellow Kenyans, the Ministry of Health would like to take this opportunity to thank our health workers for a job well done. These health workers have worked under tough conditions to be able to keep us all healthy. They also have families who they are looking after, and we do not take their cause for granted. We continue to work with our health workers to protect them and to ensure that they have the right gear to be able to work as our frontline army in this disease. We are in the process of hiring 1,000 health workers to boost capacity. With regard to personal protective equipment, as we informed you yesterday, we are scaling up on acquisition of personal protective equipment for our health facilities countrywide. It is important for us to be aware that there is a global shortage of this personal protective equipment, and in this regard, the government is engaging with local manufacturers to be able to see how we can scale up our capacities and ensure that distribution is undertaken. As per our modeling yesterday that we were able to share with you, we are quantifying needs, and we believe we shall be able to have the adequate numbers and to protect our healthcare workers. We continue to increase our testing capacities. As we mentioned, currently we have testing centers, and we're in engagement to see how we can continue opening more testing centers and ramping up our capacity of testing per day. We would like to appeal to you, fellow Kenyans, to continue working hand in hand with us to overcome this disease, and we would like you to continue following the directives set aside by the Cabinet Secretary, Ministry of Health, and the NERC. We continue to appeal to you to continue maintaining social distancing, because this is one of the key measures that is effective against this coronavirus disease. We appeal that you continue to utilize the call line facility 719 and report on any cases with regard to the disease. We are also continuously engaging with our county governments who remain committed in this and are putting in place proactive measures that will continue to ready us in the fight against this disease. We continue asking Kenyans to continue observing the various directives issued with regards to hand washing, maintaining sanitation, and in transport. We reaffirm the government's commitment in engaging and mitigating against this coronavirus disease. We thank you.